Welcome back to the second portion of the Technology Hour. We're visiting today with Owen Fonorow. He's the co-founder and director of Vitamin C Foundation, and we're discussing the current science on or heart technology, and we've just been talking about Linus Pauling's research and, of course, discovery on heart disease. You were talking about the powdered form and.
Right. Well, the heart technology has tried to incorporate. I could say the little story behind the company is that the founder had known Linus Pauling personally, had been up on at the Malibu Ranch, and when this work on lipoprotein small a was being done, and Pauling had made a statement. He said, if these experiments turn out as we think they might, it would mean that heart disease could be eradicated. And that stuck in this entrepreneur's brain. And, of course, the experiments did pan out. This were with guinea pigs, and they did find lipoprotein A elevated in the guinea pigs that were deprived of vitamin C. And so he tried to be faithful to Pauling and went around looking for other products that might be able to give the amounts that Pauling was recommending, and there were none at that time. So he made the product for himself. And he wanted it to taste good, to be drank, to avoid the pills. And then it occurred to him if if other people might find it useful also, and it's called Heart Technology from Tower Labs. And it provides either 3 grams of lysine and vitamin C as a prophylactic or 6 grams of each for therapeutic, and some people are even taking more. As I mentioned with Mr. Fennelson there, he took a lot more vitamin C, and he had a very rapid turnaround in a 10-year cardiovascular problem.
Now this product that he took, was it the heart technology product?
He started actually just taking vitamin C and lysine. We put him on heart. He ordered heart technology, and he got that within probably a week. So he has been taking heart technology from, I'd say, the first week on.
When you get the heart technology, and it's, I guess, by a tablespoon or teaspoon or whatever you do.
2 measured teaspoons in water.
So how much vitamin C is in just 1 teaspoon then?
Well, in the serving is 3,000 grams.
So that's a safe, and then, of course, you can go up from there.
And it's designed, so that you can actually go to 2 to 3 to be in the therapeutic range.
Okay, but then maybe more times a day, even.
Right.
Right.
And that's, people have to, it turns out there is a wide range in people's tolerance for vitamin C. Mine, one of the reasons probably I'm so enthused about this is I was able to take the same 18,000 milligrams a day, and I have been since 1986, that Pauling was taking. Other people might be, have trouble with 200 milligrams. They start to have trouble with it. So there is a wide range, but most people, it turns out, can take about from 4,000 without any problem a day. Sometimes.
And, Owen, I know that the folks that have suffered from hepatitis, of course, this is, you could say, a therapy that has been known for a long time to, of course, begin on the vitamin C crystals and work up to 18,000. That's the target. But then, of course, go slowly and go to the point where day by day you increase to the point where there's diarrhea, and then you back off, and then you kind of stabilize, and then you can continue to work up.
Right, and I'm not...
So, a lot of people that have liver congestion, that is a determining factor of why they can't tolerate more.
Right. That's true, and I don't know what the answer is for why there's such a range in the normal population, but it might be worth taking a few moments to talk about Dr. Cathcart's bowel tolerance finding.
Okay.
And that finding was that people can, tolerate between 4 and 16 to 18 grams a day, and those people, when they're well, that doesn't change. But when they become ill under stress, then their bowel tolerance can go up to 50, 100, even 200 grams. So 10 to almost 100 times more vitamin C can be absorbed when they're ill or under some kind of a disease condition under stress. And then when that disease condition goes away, they go back down to their normal day-to-day bowel tolerance. And what's very fascinating about that chart is that you can use it, and doctors should be using it, you can diagnose the organism that's attacking you, because you can look on his chart.
Isn't that something?
And you can
Do you offer this chart?
The chart is at orthomed.com, orthomed.com. It's the he first published this in the 1980s. It's titrating. You look for his titrating paper.
Oh, the titrating?
Yeah, titrating the bowel tolerance, and there the chart is on that paper. It's on the internet. And what's fascinating about it, one time I was up to about 150 grams a day without any diarrhea. I was having something, and I looked on there, and I saw there was really no viral illnesses. The only chance was it was a bacterial, and then I went in, got myself a antibiotic, and went right away.
Wow.
So you can use the chart to help differentiate certain viruses from bacteria. I'm sure the SARS thing probably is enormous. I know mononucleosis is 200 grams a day. People who have mononucleosis can take 200,000 milligrams of vitamin C without getting diarrhea.
So it's very effective for virus.
Very effective. And that's Thomas Levy's whole thesis. If you go back in, you can actually, it takes IV doses, but at very, very high doses it can destroy viruses. So that's another aspect of this that's going to come into fruition. But if we could get back to heart disease, I don't know how much time I have. I would like to mention this study in the Journal of the American Medical Association, because I'm sure some of your listeners out there are saying this is all well and good, but what is there any science for this? Is that possible for me to go ahead with that?
Oh, sure. We're probably going to have a break here in just a minute.
Okay, well, I'll just stop talking when I hear the music.
Okay.
But there was, by the way, I'm a very, very strong proponent for chelation therapy, for removing the heavy metals. I know of the anti-cancer effect, and I think it's probably helpful for heart disease, although I think the vitamin C is crucial. And the successful chelation therapies are also getting vitamin C. But anyway, I was talking to one of the Dr. Waters in Wisconsin is one of the pioneers in chelation therapy, and he said, did you hear about that JAMA trial? They gave vitamin C as the placebo. And I was shocked, that they would do something like that, not thinking that it was spelled out in the paper, but it's completely spelled out in the paper. They gave both groups, and this is, it's called a chelation therapy for ischemic heart disease, a randomized controlled trial in the January 23rd, 30th, 2002 issue of JAMA, Knudsen et al. And in there, what they had is what the press or the story, the reason they got it published is they said there was no value in EDTA over placebo. But what you didn't hear was that both groups increased these are heart patients. There was a placebo group and this EDTA group, but both groups were given 5 grams of vitamin C and 750 milligrams of magnesium IV, and both groups increased their time 60 seconds on the treadmill, and they say in the study that's what we were looking for. So it's not as if EDTA didn't work. Both, they didn't have any increase in time to ischemia. Both groups had it, and they gave both groups vitamin C. And so it really is a very interesting confirmation of the Pauling therapy. I went back into Medline looking to see if there was anything else that could provide that kind of increase in the treadmill time, and I did find a testosterone patch was close, but for instance, the statin drugs, I talked to the author of the study, did not show any increase in time to ischemia on a treadmill. So, what we have really is one of the first times we've got something published, only because it seemed to debunk EDT chelation, but it showed that these heart patients getting vitamin C had a significant, measurable, objective improvement in their time on the treadmill.
That's wonderful.